U.S. kindergartners miss vaccinations at record rate. A record number of U.S. kindergartners missed out on required vaccinations last year, setting the stage for a surge in measles cases that has left experts scrambling to sound the alarm. According to new data from the U.S. Centers for Disease Control and Prevention, CDC, about 3.6% of incoming kindergartners in the 2024-25 school year had an exemption for a required vaccine, leaving around 138,000 new schoolchildren without full coverage for at least one state-mandated vaccine. But here's where it gets concerning. Exemptions jumped more than a full percentage point over the past 4 years, with the vast majority, all but 0.2%, being for non-medical reasons. And this is the part most people miss. About 286,000 kindergartners had not completed the measles, mumps, rubella, MMR, vaccination series in the 2024-25 school year, as cases climbed to the highest they've been since the disease was declared eliminated in the U.S. a quarter-century ago. The CDC data shows that MMR coverage dropped to 92.5%, marking the 5th year in a row that coverage has been below the federal target of 95%. The vast majority of this year's measles cases have been in unvaccinated children. So, what's driving this trend? Experts say that vaccination remains the most effective way to protect children from serious diseases like measles and whooping cough, which can lead to hospitalization and long-term health complications. But the decision to vaccinate is a personal one, and parents should consult their healthcare providers on options for their families. However, the American Academy of Pediatrics, AAP, is sounding the alarm, saying that non-medical exemptions to school immunization requirements should be eliminated. The science behind vaccines demonstrates that the benefits greatly outweigh any potential risks, and there really aren't good reasons to opt out. But the reality is that vaccine exemptions increased in 36 states, according to the new CDC data. In 17 states, more than 5% of kindergartners had exemptions, meaning reminders from administrators to complete paperwork or doctor's visits won't be enough to raise coverage to the 95% goal for 2 doses of MMR vaccine set by the U.S. Department of Health and Human Services, HHS. So, what can be done to turn the trend around? Experts say that vaccines can sometimes be victims of their own success, with people not realizing how much protection they offer until they see the suffering that can happen when they're not utilized. This year's measles outbreak, which has led to 3 deaths and dozens of hospitalizations, mostly among children, may raise the urgency around the need to vaccinate and help to start to turn the trend around. In fact, experts say that the declines in measles and other vaccines are always concerning, but perhaps in the context of one of our larger measles outbreaks in recent memory, a lot of people have it in mind with returning to school this fall. So what's the takeaway? Experts say that it's always good to remember that the vast majority of parents vaccinate their kids on time and according to the recommended schedule. When that's not true in a school or in a community, it's an opportunity for advocates to speak up and talk to other parents and be partners in the process of improving vaccine confidence. But here's the question. Will this be enough to turn the tide and get more parents to vaccinate their kids? Only time will tell. What do you think? Do you think vaccine exemptions should be eliminated? Share your thoughts in the comments below. Vaccination rates drop. Is the U.S. at risk of measles outbreaks? The United States is inching closer to losing its hard-won protection against preventable diseases, and it's happening quietly under the radar. Vaccination rates among American kindergartners have taken another small but significant dip, raising alarms among public health experts who warn that even minor declines can have major consequences. According to newly released data from the Centers for Disease Control and Prevention, CDC, MMR, measles, mumps, and rubella vaccination coverage fell from 92.7% in the 2023-2024 school year to 92.5% in 2024-2025. While the percentage may seem negligible at first glance, it translates to roughly 286,000 children entering school without full protection against measles, a disease that's making a troubling comeback. And this is the part most people miss. The numbers may look small, but they represent real vulnerability. The U.S. has already seen a surge in measles cases in 2025, surpassing any year since the disease was officially declared eliminated in 2000. In fact, case counts are now at their highest levels in over 3 decades, reigniting concerns about how easily preventable diseases can resurge when immunization rates fall. This isn't just a one-time slip. It's part of a concerning pattern. Back in the 2019 to 2020 school year, 95% of kindergartners were vaccinated against measles, a figure that health experts consider the gold standard for achieving herd immunity, the threshold needed to stop the spread of infectious diseases within a community. But the pandemic disrupted routine care, and vaccination rates began to slide. By 2020 to 2021, MMR coverage had dropped to 93.9%, and the decline hasn't stopped since. Here's where it gets controversial. While some of the initial drop was due to logistical challenges during the pandemic, the continued decline points to a deeper issue: the growing influence of anti-vaccine sentiment. Despite improved access to vaccines, more parents are choosing not to vaccinate their children for non-medical reasons. In the 2024 to 2025 school year, non-medical exemptions hit a record high, driven largely by ideological beliefs and misinformation. And now, Robert F. Kennedy Jr., a vocal critic of vaccines and a key figure in the anti-vaccine movement, sits at the helm of the Department of Health and Human Services as the nation's top health official. So, what does this mean for the future of public health in America? Is the growing hesitancy toward vaccines a personal choice or a public health threat? And should the government be doing more to counter misinformation, even if it means challenging deeply held beliefs? These are questions that deserve a national conversation, and we want to hear your thoughts. Do you think the decline in vaccination rates is a cause for alarm? Or are concerns overblown? Share your take in the comments below. Kindergarten vaccination rates drop. Measles risk exemption surge explained. The alarming trend of declining vaccination rates among kindergartners is raising significant concerns, especially as the number of exemptions reaches unprecedented levels. Recent federal data reveals a troubling decrease in vaccination coverage for young children in the United States, which could have serious implications for public health. According to the latest statistics released by the Centers for Disease Control and Prevention, CDC, the vaccination rates for kindergartners during the 2024-2025 school year have dropped across all reported vaccines compared to the previous year. Specifically, only about 92.1% of kindergartners received the diphtheria, tetanus, and acellular pertussis vaccine, DTaP, while 92.5% were vaccinated against measles, mumps and rubella, MMR, and polio. These figures represent a slight decline from the prior school year, which is concerning given the current health climate. This decline in vaccination rates coincides with a surge in measles cases, the highest the U.S. has seen in over 3 decades. A significant portion of these infections has been linked to an outbreak in West Texas, predominantly affecting unvaccinated children and teenagers, or those whose vaccination status remains unclear. Experts warn that as vaccination rates continue to fall, the likelihood of outbreaks increases. Alarmingly, current vaccination rates have dipped below the critical threshold of 95% needed to achieve herd immunity, which is essential for protecting those who cannot be vaccinated due to medical reasons. Moreover, the data indicates that exemptions from vaccinations among U.S. kindergartners have also reached an all-time high, rising from 3.3% to 3.6% in just 1 year. This increase in exemptions was observed in 36 states and Washington, D.C., with 17 states reporting exemption rates exceeding 5%. This trend raises questions about the growing hesitancy surrounding vaccinations and the potential risks it poses to community health. Dr. Celine Gounder, a medical contributor for CBS News and an editor at KFF Health News, expressed her concerns regarding the rising number of exemptions during a segment on CBS Mornings. She emphasized that many of the fears surrounding vaccinations are unfounded, stating, "We're really seeing a lot of exemptions and concerns about vaccination that are not warranted." Dr. Gounder reassured the public that the MMR vaccine is not only safe, but also highly effective, providing lifelong protection against measles, one of the most contagious diseases known. As we navigate these troubling statistics, it's crucial to engage in open discussions about vaccination. What do you think about the rising exemption rates? Are there valid concerns that need to be addressed, or is this a case of misinformation? Share your thoughts in the comments below.